Good afternoon, everyone. Thank you to Prof. Osman for the opportunity given to me to present my topic about breastfeeding and its relationship with the reduction of breast cancer. I'm Felie Virgayani Kurniawan. I'm Master degree from Departemen Chemistry. Today, I will present my topic. This is my outline. First, I start from breastfeeding and its benefit, and then about breast cancer, how to reduce breast cancer, breastfeeding and its relationship with reduction of breast cancer, and then the last is conclusion. Breastfeeding is process of giving breast milk to the baby through the mother breast. Breastfeeding is the ideal food for baby because it is safe, clean, and contain antibodies which help protect many common childhood diseases. If we see in the picture, the table, this is benefit for breastfeeding for baby and mom. Breast milk provide ideal nutrition for baby. Breast milk contain important antibodies. Breast milk promotes baby healthy weight. Breastfeeding make children smarter. For mom, breastfeeding might help to lose weight. Breastfeeding help the uterus contraction. Mother who breastfeed have a lower risk for depression. Breastfeeding might prevent menstruation. It is safe for time and money. And then breastfeeding reduce disease risk. Breast cancer. Breast cancer is disease in which cells on the breast grow out of the control. A breast is made up of three main parts: lobus, duct, and connective tissue. Lobus is the gland that produce milk. The duct are tubes that carry milk to the nipple, and then the connective tissue is surround and hold everything together. Most breast cancer begin in the duct or lobus. Different people have different symptoms of the breast cancer. Some people do not have any sign or symptom. We can see in the slide, this is a symptom of the breast cancer. First is constant breast or nipple pain. Second, nikken is inverted turning inward. Then rash or color on skin around nipple. And then change in the size or shape of breast. Dimpling or change in the skin texture. Lump or thickening in breast or underarm. Swelling of all or part of breast area. And the last, unusual discharge from nipple. Risk factor of breast cancer. Risk factor of breast cancer based on our gen, hormone, lifestyle, and environment. And several factors are listed below. A. Most breast cancer are diagnosed after 50. Genetic mutation such as BRCA1 and BRCA2, and then reproductive history, having densest breast, personal history of breast cancer, or certain non-cancerous breast disease, family history of breast or ovarian cancer, previous treatment using radiation therapy, women who took DES drug. Type of breast cancer. This is a type of breast cancer. First is non-invasive breast cancer, duct carcinoma in situ, and lobular carcinoma in situ. Invasive breast cancer include invasive duct cancer, inactive lobular cancer. And then less common breast cancer is inflammatory breast cancer, Paget disease. How to reduce breast cancer? Keep a healthy weight, exercise regularly. Don't drink alcohol or limit alcoholic drinking. If taking hormone replacement therapy, or birth control pill, ask a doctor about the risk. If have a family history of breast cancer or inherit change in BRCA1 and BRCA2 genes, talk to a doctor about other ways to lower the risk. And then the last is breastfeed if possible. We know estrogen hormone contributes significantly to the formation and growth of breast tumor. High level of serum estrogen and long-term exposure to estrogen are associated with an increased risk of breast cancer. Many factors of breast cancer, like early menarche, slow menopause, family with a history of breast cancer, obesity, and a high-fat diet, age of upward productivity, first pregnancy in old age, and hormone. The menstrual cycle. Menstruation is the release of an ovarium or egg cell along with the endothelium for the female reproductive organ. The hormones that play a role in the menstrual cycle are hormone produced in the ovaries like estrogen, progesterone, and testosterone, and then hormones that are synthesized in the brain like FSH and LH. We can see in the right picture, in the ovaries has two hormones in women. Estrogen, this is an important role in sexual and reproductive development, and then progesterone facilitates the implantation of the fertilized egg. And then in the brain has two hormones, LH facilitate ovulation, and then FSH stimulate follicular production. Menstrual cycle approximately occur in 28 days and is divided into three phases. First is follicular phase. FSH promotes the growth of the follicle in the ovaries. Follicle contain the egg will begin to produce more estrogen. And then the second is ovulatory phase. LH stimulated by the rise in estrogen. LH causes the rupture of the follicle with release of the mature egg from the ovary. This is ovulation. Fertilization only happens within 12 hours after the egg has been released. And then the last is luteal phase. The last phase involves the drop of estrogen level and an increase of progesterone to facilitate the implantation of the egg in uterus. If the egg is not fertilized, the follicle contracts inside the ovary. The level of progesterone decreases and the endothelium is shed and eliminated through menstruation. This is complete the menstrual cycle. Pregnancy. If fertilization occurs, the uterus begins to produce the hormone chorionic gonadotropin or HCG. It also makes production of progesterone so that the uterus continues to develop and widen for the growth of the fetus. Estrogen level also increase steadily during pregnancy to improve vascularization and transfer of nutrients to support the developing baby. Under normal conditions, estrogen and progesterone will regulate the female reproductive system, such as a menstrual cycle and change in physical body, such as a breast. Function of progesterone in pregnant women: keep the uterus muscle relaxed, maintain the thickness of the uterus wall while the fetus is growing, maintain the immune system in the presence of fetus, include the breast to produce milk. And then function and effect of estrogen during pregnancy. From new blood vessel to deliver nutrient to fetus. It helps in providing the nutrient of fetus need to grow. support fetal to grow, increase blood flow in the body, including blood flow to the skin, causing a glowing impression in some pregnant women. Oxytocin. This hormone flexes the cervix at the end of pregnancy, make it easier for baby to come out. At the same time, this hormone will also stimulate the nipple to Montgomery gland and areola to produce milk. So after birth, baby can breathe immediately. Prolactin. Hormone prolactin is beneficial in preparing breast for breastfeeding by helping to produce abundant milk. Estrogen level will naturally increase during puberty and pregnancy. During pregnancy, placenta produce estrogen, especially hormone estriol. Estrogen control lactation and help stop ovulation during pregnancy. Most women experience hormonal change during lactation that delay menstrual period. This reduces a woman's lifetime exposure hormone estrogen, which can promote breast cancer cell growth. In addition, during pregnancy and breastfeeding, breast tissue is shed. This shedding can help remove cells with potential DNA damage, thus helping to reduce chance of developing breast cancer. Breastfeeding also helps lower ovarian cancer rates by preventing ovulation, and the less ovulate, the less exposure to estrogen and abnormal cells that could become cancer. The conclusion is, first, breast cancer is caused from excessive amount of estrogen in a long-term exposure, such as early menstruation or late menopause. Second, breastfeeding can reduce the risk of breast cancer development based on the effect of the estrogen and progesterone level during pregnancy and breastfeeding. And then, third, non-pregnant women, estrogen and progesterone play a role in the menstrual cycle and physical change, such as in the breast. While in pregnant women, hormone estrogen and progesterone play a role to maintain the thickness of the uterine wall while the fetus is growing, providing nutrition to the baby and the other. This is my reference. Thank you for your attention and time. I return to Prof. Usman or Miss Filia. Thank you.